Good morning, everybody. I'm Nora Volkow, and I direct the National Institute on Drug Abuse. And today I'm representing the NIH Pain Consortium. And I want to welcome you all to this meeting on pain that brings together the various institutes to actually try to integrate better the science of that relates to pain. The NIH Pain Consortium is led by Dr. Story Landis, who is the director of NINDS, and she actually is out of town, so she couldn't be here, but we have several representatives from that institute. The Pain Consortium Steering Committee includes her, and it also includes Dr. Josephine Briggs from NCAM, Dr. Patricia Grady, director of NINR, who's here in the front row, Dr. Marta Sommerman, director of NIDCR, and myself, director of NIDA. I want to highlight that this pain consortium would not work at all if we did not have the commitment and talent from Dr. Linda Porter, who's also sitting in the front, which is the pain policy advisor, Dr. Cherise Sankar, who's the pain policy analyst, and Dr. Tara Schwetz, pain policy analyst too. And they have been instrumental in organizing this meeting as well as coordinating many of the activities of the pain consortium. I also want to acknowledge the involvement of not just these 4 institutes and their staff, these 5 institutes, but also the participation of other NIH institutes in the with their staff in the pain consortium. As you can imagine, pain involves basically every single one of the diseases that are investigated at the NIH. And because there's not per se an institute of pain, it is the pain consortium optimizes our ability to integrate efforts and resources. So I want to just highlight some of the things that have been on top of what the NIH Pain Consortium has done. And one of them is to ensure that pain is properly represented in the science portfolio of all of our institutes. And this slide shows actually that indeed we have been successful in doing this. And you can see the significant increase in funding levels since 2008 to 2013 as it relates to pain, from 279 million to 402 million last year. And considering that these are years where we have actually had decreases in funding during sequestration as well as very flat funding, this does highlight the recognition and the importance and priority that all of us as institutes has given to the investigation of pain, and also to try to translate some of that knowledge into products that can be used for the treatment and management of particularly chronic pain. These are some of the highlights that we have been doing on the past years that can be divided into 3 categories: the development of clinical research resources that can facilitate research for many others, training and educational tools that can be of use not just for research but for clinical practice, and research and discovery directly. On the development of clinical research resources, there are 2 of those that I want to again highlight. One of them relates to the Low Back Research Task Force, and this is to try to generate standards on terms of terminology, case definitions, and outcome measurements as it relates to chronic low back pain, which is necessary in order to maximize our ability to integrate studies that are done across different institutions and centers. The other one that I want to highlight is the NIH Pain Consortium Stanford University Pain Registry, which will allow to create a registry of self-report outcomes of chronic pain sufferers over time. This is extraordinarily valuable considering that we, in fact, have very little data with respect to long-term outcomes of chronic pain, and also as it relates to the treatment with medications such as opioid analgesics. While there have been other registries, many of them are tied to pharmaceutical industries, and they are not openly and accessible for investigators. So these will be an open access and therefore available for anyone that can take advantage of this resource. With respect to education and training, one of our major initiatives has the generation of centers of excellence for the development of curriculum for pain education. This relates to the facts and the recognition that there's very little education, formal education in medical schools, in nursing, in pharmacies, as it relates to the screening, evaluation, and proper treatment of patients with chronic pain. Again, you'll see me come back to the notion of chronic pain as opposed to acute pain, because acute pain overall is not as difficult to address as it is the case of chronic pain. And that's why a lot of our efforts are towards the chronic pain. The Centers of Excellence of Pain Education and then are targeted to take advantage of the enormous amount of scientific expertise that we have throughout all of the institutes to actually identify how to properly, what is the evidence that can result in the optimal screening treatment of pain that can be used as material for education in medical schools, in nursing schools, in dentistry schools, and as well as pharmacy students. And that curriculum will be available and for free. And you can generate you can take pieces from different centers and generate your own course. As opposed to actually, because that's the other thing, well, you say, well, are there not already many education material out there? Yes, there is significant educational material out there, but many of them have been funded through subsidy from pharmaceutical companies. And I think that one of the concerns has been to what extent there may be some conflict, whether it, even if it's not intended to be conflictual, whether that in turn affects the quality of the material. The other very important resource that we have is the Interagency Pain Research Coordinating Committee portfolio database that was released actually yesterday, and Linda Porter was saying it's very, very timely. It says it's perfectly timely that it came out yesterday. And what it does is it pulls together, it integrates in a database all of the pain grants that are funded by the federal agencies, and it's 1,200 pain grants, and you can, as you see, launched yesterday, and you have the ULR address there. You can go in there and learn what are the grants that relate to the pain research across all of the various agencies. And the final subjects that I want to address is our conference on the use of opioid medications for chronic pain workshop, and this is going to take place on September 29 and September 30. What is this conference and why do we want to do it? Well, we want bringing a group of experts to address the evidence as it relates to the use of opioids for chronic pain. It's not straightforward, and there's very little data if you look at it in terms of clinical randomized trials to look at the effectiveness of opioids in the management of chronic pain. It's actually ubiquitous for its absence of randomized clinical trials. I think that there's really only one that has been done in the proper sense. There have been meta-analysis of follow-up studies, and again, the data seems to indicate that a small percentage of patients continue to have positive responses. Significant and a non-negligible number of patients stops taking them because they are no longer useful, and some of them have some intermittent benefit. So clearly highlighting the need to understand when are opioids indicated for chronic pain and how do you optimally utilize it. And this has become increasingly urgent to understand because at the same time, we've seen a very, very dramatic increase in the number of opioid prescriptions in the United States. In 2011, I think it was something like 207 million prescriptions for opioids. And parallel to these increases, there has been a significant increase in overdoses from the use of opioid analgesics. And last year, it was estimated 16,000 people died from opioid overdoses. These numbers are gigantic. It actually correspond to, if you take it across the whole United States, 50% of the number of people that die from car accidents. And in some of the states, the number of people that die from overdoses is actually higher than the number of people that die from car accidents. This has centralized many of the agencies to try to understand the dynamics about why this is happening. And that's how NIDA very much is involved in all of this issue, because many of these cases relate from the diversion of opioids and the abuse and the addiction. And it is believed that they are responsible for the majority of cases from overdoses. However, what we have come to also recognize is that even when these opioids are given for management of pain, appropriately, patients can become addicted to them. So a challenge is how do you recognize those individuals that are higher risk so that you can intervene. But we've also come to recognize that those overdose, the demographics of those overdose, where you have the peak overdoses are individuals between 40 and 54 years of age, and the increases are actually even more dramatic in women than in men. And those are not demographic that can just be explained on the role of diversion and abuse by drug abusers, because it is mainly males and it is mainly 20 to 30 years old, indicating that some of these cases of overdoses are driven by improper prescription of these medications. And there are many issues that can be addressed in this, but the notion is we need to understand what are the drivers and how to improve these outcomes. We also need to recognize, because this is one of the things that people say, well, we are over-prescribing opioid medications, but we also need to recognize we are under-treating and we're improperly treating patients with chronic pain. So these two things are not exclusive. We can overprescribe, and at the same time, we can undertreat. And again, that's the importance of getting the knowledge and what this conference aims to do, to have a better understanding of how to prescribe opioids properly, how to optimally use them in order to properly manage chronic pain, and very importantly, identify areas of research where knowledge is necessary in order to improve outcomes. This is just the timelines, and as I say, this meeting will take place September 29 and 30th. There will be a report that will be released in January 2015, and hopefully that will help incentivize new areas of research.